stop.
Before we open today's file, I need you to do one thing. If you love dark history, medical mysteries, and things that make you go, wait, what? Hit that subscribe button right now.
We are digging up the history they don't teach you in school. Welcome to Declassified Diagnosis. Share this with a friend who thinks they have a strong stomach. They're going to need it.
Okay. When I say chainsaw, what do you see? Leatherface, a lumberjack in flannel taking down a redwood.
That's what everyone thinks. You know, the smell of gasoline and sawdust.
Right.
But the chainsaw wasn't invented for wood. It was invented for flesh, specifically for childbirth.
Wait, no.
Oh.
You can't be serious.
I am unfortunately entirely serious. And to understand why on earth this incredibly brutal tool was necessary, we have to go back.
Where are we going?
We have to travel back to the late 18th century, around the 1770s, to a time when childbirth complication rates were truly terrifying.
Right. I think we often gloss over just how precarious life was back then, but giving birth was arguably one of the riskiest things a woman could do.
Absolutely.
So what were the specific problems that would require a surgical solution like this?
The main problem was obstructed labor. If the baby was too large, or more often, if the mother's pelvis was too small, maybe contracted from childhood rickets, which was very common.
Baby was just stopped.
The baby could not pass, and in that situation, your options were disastrous. C-sections, what we rely on today, were almost universally fatal to the mother.
From infection.
Sepsis, hemorrhage, shock. I remember reading that historically C-sections were often for post-mortem use. It was almost a legal or religious thing, wasn't it?
That's a crucial point. Under ancient Roman law, the lex regia, an abdominal incision was typically only done to save the baby after the mother had already died.
So doing it on a living woman was unthinkable.
To perform that kind of surgery on a living woman in the 1700s, with no anesthesia, no germ theory, it was seen as a deliberate death sentence. You simply couldn't open the abdomen and expect them to survive.
So it was a true last resort.
Only when both mother and child were otherwise guaranteed to die. Okay, so if you can't cut through the abdomen, you have to find another way. You need a way to widen the passageway without entering the body cavity.
Exactly. They were in a literal death trap, and they needed innovation desperately.
And this is where the procedure comes in.
This is where the procedure called Symphysiotomy comes in. The whole idea was to widen the pelvis from below, preserving the mother's life.
Okay, so let's unpack that anatomically. What are we talking about here? What's the target?
So they were targeting the pubic symphysis. If you place your hand on the very front of your pelvis, that J,
right in the middle,
the one connecting the two halves of your pubic bone, the pubic rami, that's the symphysis. It's not bone on bone. It's a joint made of tough, fibrous cartilage.
And that softens during pregnancy, right?
It does, a little bit. But for a woman with a severely contracted pelvis, that natural give just wasn't nearly enough.
So they just cut it.
Exactly. But doing it with a knife, the tools they had, it was too slow, too messy, it took too long.
And the pain. I mean, we have to keep reminding ourselves, this is pre-anesthesia.
No anesthesia at all. Chloroform for obstetrics wasn't really used until the 1850s.
So imagine the scene. You have a patient who is conscious, screaming, already exhausted.
And a surgeon trying to reach deep into this recessed area to saw through dense cartilage and bone with a slow, blunt knife.
It sounds impossible.
The procedure was excruciating. It was messy, and the longer it took, the higher the risk of shock and later fatal infection. We even know about one of the first patients, a Madame Suchot in Paris, 1777.
What was her story?
She had a contracted pelvis and had already lost 4 babies. She and her child both survived the procedure, but it was clear to everyone that they needed a better tool. They needed something faster, more precise.
Something that could make a cleaner wound.
Yes. In that era, speed literally equaled life. Faster meant less time suffering, less time in shock.
Which they actually considered humane.
It's a grim, utilitarian view of humane, but yes, that logic is what led directly to the invention of the chainsaw.
So who were the inventors?
It happened around 1783, maybe 1785. The prototype was pioneered by 2 Scottish doctors, John Aitken and James Jeffrey.
Scottish obstetricians. So this isn't some frontier woodsman's invention. This is coming out of a university.
Exactly. Jeffrey was a professor of anatomy and surgery in Glasgow, and their invention, it wasn't the roaring gas-powered tool we know today.
What did it look like?
It was called a chain hand saw, or a flexible saw. Picture a very fine serrated link chain, almost like a miniature bicycle chain,
Okay.
with tiny little cutting teeth on the links, and it was operated by hand with two handles, one on each end.
So wait, it was literally just hand pulling a chain back and forth through bone, like a rope saw.
That's precisely what it was. Aitken even illustrated it in his 1785 book, Principles of Midwifery, specifically for the Symphysiotomy.
So you're essentially flossing through the bone.
Yes, it cut faster, which meant less time screaming. It was considered humane back then.
I want to pause on that word, humane. Reducing screaming time is one thing. But what about the after effects? Were they even thinking about the long-term trauma of severing that joint?
You're cutting right to the heart of 18th century medicine. Their goal was acute survival, saving the mother from dying right there in labor.
And if she lived, it was a success. End of story.
Exactly. They didn't have our concepts of physical therapy or long-term patient follow-up. The immediate life-threatening necessity it trumped any thought of chronic consequences.
And that focus on acute survival is what allowed the idea to evolve then. The tooth chain worked.
It proved effective enough as a cutting mechanism that it soon evolved beyond childbirth. By 1830, a German surgeon named Bernhard Heine, he mechanized it.
Mechanized it how? This is where the crank comes in.
He had the crank. Heine called his invention the osteotome, which just means bone cutter.
So he took the flexible chainsaw and made it a continuous loop.
Yes, the crank drove the chain around a guiding blade. This gave you much more precision, consistent force, a mechanical advantage far beyond just pulling it by hand.
That sounds much more like the tool we know today. Power source is just the surgeon's elbow.
Precisely. And this tool revolutionized orthopedic surgery for a time. It became essential in the 19th century for excising diseased joints, knees, elbows, amputations.
So instead of a hammer and chisel?
You had the osteotome. It was consistent. It was fast. So it went from childbirth to cutting out rotten joints, but still inside the operating theater.
But we have to go back to that original procedure, the symphysiotomy. What was the long-term cost for the women who survived it?
The morbid reality is it's significant. The procedure was life-saving, yes, but it could be devastating for mobility.
And they kept doing it for a long time in some places, didn't they?
They did, particularly in Catholic countries like Ireland well into the 20th century. It was seen as preferable to repeated C-sections or sterilization, which were ethically complicated.
So religious doctrine kept a physically devastating procedure in practice.
For a while, yes, but it was largely abandoned elsewhere because of the major morbidities. The adverse outcomes were severe.
Like what?
Chronic pain, for one. You've created instability in the pelvis, which affects the hips, the back, and then there were the urinary problems.
I imagine stress incontinence would be a huge issue.
It was, and it could show up decades later. But the mobility issues are probably the most chilling. We have accounts of patients saying they had to learn to walk again.
Of course, the main joint holding the front of your pelvis together is gone.
Some women would collapse just trying to walk too soon because the joint hadn't stabilized. It could lead to a lifetime of physical incapacity.
Permanent disability for a life saved. It's such a dark trade-off.
It really is. It wasn't malice, it was desperation. Desperation coupled with an incomplete understanding of long-term biomechanics.
And then eventually it fell out of favor in surgery.
Yes, the surgical chainsaws were eventually superseded in the late 19th century by the giggly twisted wire saw. It was a simpler, less traumatic, flexible wire that did a similar job. So the era of the mechanical surgical chainsaw was pretty much over.
So the idea basically went dormant in medicine, and it took almost 100 years for someone to look at the osteotome and see a tree cutter.
It did. And the transition happened in the United States, driven by the massive scale of West Coast logging.
Let me guess, California.
San Francisco. A logger named Samuel J. Benz. He applied for the first patent for an electric chainsaw in 1903.
Electric. So he saw Heinz design and just thought, I can replace the hand crank with a motor.
That is precisely the bridge. Benz designed his endless chainsaw specifically for felling the giant redwoods. The medical need for rapid bone cutting morphed directly into the industrial need for rapid wood cutting.
That's incredible. The direct line from a desperate operating room in Scotland to a logger in San Francisco, it's a perfect example of how technology jumps from one domain to another.
And from there, the modern era happened very quickly. After World War I, you get the portable, motorized versions, Andreas Still, a name you'll recognize.
From the hardware store, yeah.
He patented an electric one in 1926, and then a gasoline-powered one in 1929. At the same time, another inventor, Emil Lerp, developed the first mass-produced gas chainsaw.
And the tool was completely transformed from this gruesome, specialized surgical instrument to a global industrial powerhouse.
And what's really fascinating is that the legacy of its medical origin, it still influences the design today.
How so? What's the modern equivalent of that surgical trauma?
Well, the modern industrial chainsaw subjects its user to intense, constant vibration. And if a worker uses a gas-powered saw all day, every day,
They're going to have problems.
it leads to a condition called hand-arm vibration syndrome, HAVS.
So the industrial version of the complications, instead of pelvic instability, it's nerve damage in your arms.
It's an occupational disease. It affects blood circulation, nerves, especially in the hands and fingers. So the tool designed to minimize trauma for the mother in the 1780s created a totally new kind of chronic harm for the industrial worker a century later.
It's the same pattern, isn't it? Ingenuity solves one problem and creates a new one down the line.
Precisely. And to combat HAVS, manufacturers like Still and Husqvarna invested millions in safety. Still introduced the first anti-vibration handle back in 1964.
So even the safety features we have now are part of that medical legacy. They're trying to protect the human body from the tool's power.
It's a direct, modern analogy, a realization that the tool has to be refined not just to be effective, but to protect the person using it from its own destructive force.
The story of the chainsaw is really the story of human ingenuity, first to save a life, and then to mitigate the chronic harm that very ingenuity created.
It's a dark, fascinating loop. From medical necessity to industrial force and back to medical considerations again.
I will never look at a hardware store the same way again.
That's the file for today. Thanks for listening to Declassified Diagnosis. See you in the next one.